Pharma Secretary Dr. Arunish Chawla and adds that the government will announce a new scheme for medical device manufacturing. Also shares the government's take on GST on pharma products. Listen into this exclusive conversation he had with my colleague Prakash Priyadarshi.
PLI schemes have done exceedingly well, and now we can confidently say they have exceeded expectations. Particularly the segment that you talked about, the bulk drugs and medical devices. 50 large greenfield projects have come up all over the country. And this includes 30 bulk drug projects and 20 medical devices projects. A very impressive import substitution has been obtained. And you will be thrilled to hear that narrative has changed. And in the closing year, we exported more bulk drugs than we imported. Okay. That's awesome. And in terms of medical devices, our import dependence going forward will come down. And we are very happy to announce that in the closing year, in the area of medical and surgical consumables, we became an export-oriented industry. Okay. And exports in this segment exceeded our imports last year.
There was demand that the government should expand the list of life-saving drugs eligible for GST and import duty exemption. So are you also considering this? Can you give some details about it?
As you know, there were some life-saving drugs, including anti-cancer drugs, which were exempted from custom duty in the recent budget. And Honorable Finance Minister herself announced it in her budget speech. In addition to that, we have a large number of life-saving drugs now on the list of essential medicines, whose prices are subject to price control. And even going beyond that, we have identified very expensive medicines, particularly for cancer and some, rare diseases, which have been brought under trade margin rationalization. This is a continuous work, and as and when more are identified, they'll be brought up under a similar affordability control.
So two very important points coming out of Pharma Secretary commentary. One, that the PLI or medical devices is working well and we have become